Welcome to the Psychiatrist Waiting Room, a show where I interview my dad, a psychiatrist with 55 years experience, all about mental illness. The aim? To explain mental illness as simply as possible. Welcome, Dad.
Good morning, Georgia.
And you're 80. You turned 80 2 weeks ago. How does it feel?
Is this a subject on ageism?
No, it's age impressivism.
Is it?
You're still working at 80.
Yeah, I mean, if I was working at 50, no one would care, you know, and they admire me for being 80. Because it's quite interesting just about ageism before we get into the topic is what I've noticed over the years, as there's a younger generation of children and grandchildren, they actually tell the older generation who they are, like you are 80. Anyway, let's go on with it.
How does it feel, though, to be told who you are? It should be the other way around, shouldn't it? I mean, you are the warriors. You are...
Well, there is a concept that if you're 80 and you've still got your faculties, you must be a marvellous person.
Well, it is impressive. Now, today we have a first. We are going to answer 2 listener questions.
Right.
Ready?
Yep.
Debbie emails. Hi, Dr Cassimatis and Georgia. Can you please explain the following behaviour and what it is? 3 question marks. My aunt was married to a man who accused her constantly of cheating on him, but his behaviour was bizarre. Firstly, she was in love with him and she was very committed. She did not have a cheating bone in her body. But he would come home from work, look in the dishwasher and accuse her of entertaining her lover because there were too many coffee cups in there. He would smell the bed sheets to see if she had had sex that day with her lover, accusing her of it. If she went to the shops or to school drop-off, he would accuse her of doing a detour to see her lover. What is this behaviour? It just doesn't seem like basic jealousy.
Okay, so the main thing here, of course, is we don't know how old the patient is or the person is, but based on what you're telling me, I would have to think clinically about this pathological jealousy.
So hang on, that's what it's called. It is called pathological jealousy.
Right. And yes, and what are the causes? Now, we can eliminate a number of things which are medically, like some medical conditions or dementia or some other unusual cases or alcohol, drugs, substances, and then we come down to the major mental illnesses like schizophrenia, bipolar disorders, etc. And then some of the minor ones like personality disorders. But rather than giving a lecture on this, and these conditions, what Debbie's suggesting to me is the most likely explanation is a schizophrenic episode or behaviour because of the bizarreness of it. That it just doesn't make sense. It doesn't pass the pub test that someone would be doing behaving in that manner and be what we'd call normal in the pub test. So I'd say that her description is most likely to fit a schizophrenic picture. However, let's assume that's not the case and just talk about jealousy as such. So Shakespeare had a play called Othello, and it was based on the fact Othello, who was a black person and in love with Desdemona, that he believed that Desdemona was having an affair with, I think it's Cassio.
But it's because Iago, Othello's friend, planted the seed in Othello's head. Well,
of course, Shakespeare makes it much more complex than just Othello himself, and why he chose a black man. But this sort of gets to the basis of it all in general, in what we would call none of those psychotic episodes due to psychosis or drinking or drugs, etc., or a medical condition. We're looking more at the vulnerability of a person who's going to get jealous and paranoid. And in Othello's case, I think what Shakespeare is painting is a black man, which is a sort of a racist comment because they would have been seen 300 years ago as inferior and weak, and that Iago, the man you just mentioned, is jealous of a black man doing better than him. So out of his jealousy, he then plants the seed that Iago's wife is playing up.
That Othello's wife is playing up. Iago
And
plants
so the
seed,
message in that is, one is the cruel behaviour of Iago in being jealous, and also the vulnerability of a weak man who was easily influenced and would believe those things because of his low self-esteem or his status. So getting back to Debbie, then the most likely thing is if the husband isn't psychotic, then he's feeling inadequate, and he considers that his wife therefore would have a better suitor, and he wants to find out. Or he himself is having affairs and thinks that she's doing the same, which is not tolerable to him, but it is tolerable to him that he'd be having the affair, but he'd be intolerable of her, and he'd be trying to find out if she's behaving like him, which is called projection, projecting onto her his own behaviour. So you can see, Georgia, that it's quite complex working out clinically rather than just a simple thing that why they're jealous. But I think the core in everyday life, if I reflect on my patients, rather than a lecture on paranoid jealousy, that most of the patients I see in my practice are not the men. I see the ones who have a major mental illness, but the other ones are the wife who's struggling with the husband. And the husband, if he comes in, will play it down and deny it and give a very logical explanation.
For his possible cheating behaviour.
For his conspiring to actually catch her out and prove she's worse than he is.
Wait, so she's seeing you because of his accusatory behaviour or because she thinks he's having affairs?
No, she's seeing me because she's depressed and miserable by this behaviour.
The jealous behaviour.
Yeah, and she's starting to be a victim of this coercive behaviour. So she comes to the psychiatrist and says, I'm unwell, this, that and the other, in an inquiry. She's saying, my husband's accusing me of all these things. It's not true and I feel miserable, don't know what to do about it, what's going on. And then that's the problem, is less likely to see the jealous person. They usually come in as a spouse or because they've done something, maybe assaulted their partner or something like that.
Well, I was going to say, when does it become dangerous? When does the pathological jealousy of these extreme accusations actually become dangerous to the point where it should possibly be reported or you seek professional help?
Oh, it's when the jealous person develops low self-esteem. Let's assume also there's a possibility that he is functioning badly in the bedroom and having difficulty, and he thinks less of himself, and his wife is therefore having affairs with other people. So what happens is that in the paranoid jealous behaviour, there's also this low self-esteem and shame that they aren't good enough. And you run the risk then of the man committing suicide or assaulting and murdering his wife or possibly killing both.
So really you should be getting onto this sort of behaviour with a professional pretty early in the picture.
Well, yes, if you can.
Now, the twist in that story, by the way, the twist in Debbie's email is, I didn't tell you this part, the clincher is that he apparently was having an affair.
Oh, there you are.
That was obviously projection, but it's such an extreme form of projection. That's
well,
extreme.
He's on his way to... He's got to blame her. He hasn't got the personality strength or to take responsibility for his behaviour.
Right.
So he projected onto her, and she will be the cause of the breakup. And he'll put that out on the blower, or he'll say that to the therapist or whoever, and that's why he had to leave her.
Okay. Listener question number 2. This is a popular one, actually, from Suzanne. Hi, Georgia and Dr. Cassimatis. Can you please explain the difference between sociopathy and psychopathy? What is a sociopath as opposed to a psychopath?
Well, in real terms, they're interchangeable. These terms really antisocial personality, and they're old-fashioned terms when they used nice and descriptive language 100 years ago to describe behaviour.
Is it also known as antisocial personality disorder?
Yes, it's antisocial. Now it's classified as antisocial personality disorder. But in general terms, a psychopath is considered to be a criminal, a really bad person who tells lies, harms people, has no conscience, robs, kills, etc., without any compunction whatsoever. And the characteristic of the psychopath is they don't form attachments, they don't actually bond with human beings. They lack empathy and warmth, etc. They're just hard, bad bastards. In popular culture, the antisocial personality is more of somebody who may be belonging to a group or a gang or a community, but is also doesn't have a conscience about what they do. They tell lies, they steal, they can form some bonds with some people, but not with the general wider community. So they just seem to be better functioning bad people. So they're the distinctions. And there was a psychiatrist, I think his name was Herbie Clickley, back in the 1940s, who talked about the psychopathic businessman.
Yeah, I was going to go.
And I can't, just remembering in a nutshell that we see these highfalutin, functioning men or women, but men in big companies, but they have no conscience about taking over companies, sending people broke, taking advantage of their staff. They're just ruthless. We probably see them in everyday life and on soapy television.
Right, yeah, you've always got
They're the
the
ones
evil
that I
character.
think intrigue people more than that horrible psychopath who's just a criminal. Yeah.
Psychopaths on the whole are criminals, really, but the sociopath is more the businessman who's ripping everybody off.
Oh, the way we see it nowadays, yeah.
Just what are the top 3 characteristics of a sociopath and then the top 3 characteristics of a psychopath?
Well, they're very similar. The top 3 are I've mentioned most of them, is that they have no conscience, they don't form close attachments, and they're absolutely dishonest and criminal without any concern about the harm they cause.
Now, I would think that Harvey Weinstein is a classic. You know Harvey Weinstein.
Yes, I don't think that Harvey.
He's a psychopath or a sociopath?
Well, we don't. I'm not sure that Harvey was criminal in his work, making films and productions.
No, but in his personal secret life.
So he's only with women,
right?
Where he conned them into coming up to his room. He had the power to get them to touch him, and those sorts of things. Yeah, so he was very cunning, but I don't think that's sociopathic, because we haven't got any evidence that he was like that in business, that he was ruthless, uncaring, or with his family or other people. So basically what we're talking about when we're talking about sociopaths and psychopaths is they're disordered. They do this
in
everywhere, every
right.
aspect of their life, with their family, with their work, with their friends, with their education, with their sports. They're telling lies, they're conniving, they're working out their angles.
So, for example, a pedophile or a rapist, wouldn't they be how do you classify that? You don't classify them in either category.
Well, they're really criminals, because they're criminals,
yeah.
You're going to talk about their personality. We've got to see something wider than that they do. Well, they're most likely...
Across the board.
Yeah, they're most likely to be psychopathic. That doesn't come out in the media about their lifestyle elsewhere. Take Donald Trump, okay?
Yeah.
Now, Donald Trump's out there barking and fighting with the legal system since he was a teenager in New York. If you read his book, he's been fighting with court cases and councils and government all his life. He's been wanting to clean up the swamp, as he said in the 2016 election. But if you notice that he never used his family in the media, like his children. He gave them jobs, but he never flaunted them, paraded them. He remained, and the family has remained close together. And so you have to look at Trump and say he's got sociopathic behaviour in some areas, But in other areas, he hasn't got that, as we can see in the public view. And the one I noticed is that his family have remained fairly loyal, and he hasn't paraded them around to make himself look good.
Gosh, there's a lot to unpack with sociopathy and psychopathy and criminality.
Yeah, it's not just the black and white.
No, it's not black and white.
No, there's sort of people who are grey and in the middle.
Yeah. On that note, we're going to wrap it up because we keep these short and sweet.
Thank you, Georgia.
Thanks for joining us, everyone. If you'd like a question answered, please email me at georgiacassimatis@yahoo.com. See you next time. Bye, Dad.
Bye, Georgia.